Functional movement disorder is the subject of this video, so stay tuned. Hey, I'm Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Posture, Movement, and Chiropractic Clinic. Let's talk about functional movement disorder. So first of all, not every movement is functional, and frankly, unfortunately, most of us, because of the fact that we don't have a normal, healthy lifestyle. I'm not talking about your eating. I'm not talking about you working out after work. I'm talking about your most of the day posture as you're working, which requires a lot of sitting. So that becomes an unhealthy working lifestyle. So when we have that, we're moving, but we're dysfunctional. There's a difference between functional movement and dysfunctional movement. So I can go from point A to B in the best functional way, meaning every part of my body, all the muscles are cueing in, firing at the right time, phasing out at the right time. I'm carrying myself the way I'm designed to move. That's functional movement. I can go from point A to B as if I'm drunk and still make it to point B at any cost, and that's dysfunctional movement. So if you start looking around, perhaps looking at yourself is not as easy, but when you start evaluating people as you're people watching, you'll notice that people walk differently, their arm carries differently, their arm swing is differently, their head, oh my gosh, there's so many variables, I'm not gonna bore you with it. But start paying attention to see what is functional and what is not dysfunctional, what is dysfunctional. We generally can see that people with good posture are more attractive in the way they move around. They're more fit. You can have big muscles but still not be fit because you're dysfunctional. So for example, if your shoulder joint is not where it needs to be because you're rolled forward and you go to the gym and you think you're working on your posterior deltoid, but in reality you're not, and you create even further dysfunction because you're working out the muscle that is already doing the job and you're working it out even more, which now makes the dysfunction being more ingrained in you. It's a huge thing. It's very, it could be discouraging because it's like, oh my gosh, I don't even know what I'm doing. So my suggestion for you then is to make sure you take a piece of your portion of your body and you really start understanding the big pictures about it. You don't need to know the terminology. You don't need to know the function of it necessarily, though it does help. So start paying attention, chipping away the dysfunction little by yourself would be beneficial. At any rate, I just wanted to bring that up to you because I think we're misunderstanding what fitness is, what function is, and a lot of times we think if you go to the gym and you have muscles, you must be fit. And here I am telling you, not necessarily, because if you have more of a workout of certain muscles and not necessarily moving functionally based on the design of your body, you're creating more of a dysfunction than when you didn't go to the gym. I'm breaking some of the paradigms that you may have, so I hope you can deal with that. If not, look into it. If you have any questions, make sure you use one of the methods of contact in the description box to ask me your questions. Until next time, take care.